Minister. I now call on Deputies Colm Keaveney and John Brown, who share their time, I understand. Is that agreed? Agreed.
Cathaoirleach. Fianna Fáil supports the bill in principle. We would do because we published similar legislation in November 2012. That bill would prohibit the use of trademark, logo, brand, business or company name or other identifying marks on packaging or on tobacco product. That bill would have provided for the regulation, the use of any design of packaging or any design of a tobacco product, otherwise related to the appearance, size or shape of packaging or of the tobacco product itself. The opening, the contents of the package, any information to be included or omitted on the packaging. Cathaoirleach, manufacturers would only be permitted to print the brand name in required size, font, location of the package, which would have been predominantly dark green, containing health warnings, including provision of graphic imagery highlighting the damage of smoking. It would also be an offence to buy, sell or import or manufacture any tobacco product which did not comply with the aforementioned proposals. The provisions and objectives of the bill currently before the House have much in common with what we had proposed in legislation. The bill will control the design, the appearance of tobacco product, will remove all forms of branding, including trademark, logo, colour, graphic, from the packs, except for the brand of variant names which would be presented in a uniform typeface. The objective of the bill is to make tobacco packs look less attractive to consumers, to make health warnings more prominent, to reduce the ability of packs to mislead people, especially children, about the harmful effects of smoking. It is not aimed so much at those who are already addicted to these harmful, lethal products, but rather at preventing children from taking up the addiction in the first instance. Like many here, I've been subject to lobbying by various groups opposed to this bill. Some of the arguments deployed have included a view that the packaging of tobacco products makes little or no difference to the consumption level of the drug. However, we know that the tobacco industry have cynically invested heavily in package design in order to subliminally communicate specific messages to various groups in society. This bill will take away one of their significant promoting tools about creating a desirable product. As the majority of smokers start off when they are children, packaging eliminates, by definition, any attraction directed mainly at young people. Cathaoirleach, international research has shown that plain packaging discourages young people from smoking in a number of ways. Young people find plain packaging less attractive, it's not as sexy, it doesn't have the mojo, and they're seen as simply less cool. Plain packets prevent any confusion about lighter coloured packs being less harmful to smokers. We know from internal documents, indeed from the tobacco industry, that this has been one of their most crass and cynical tactics to lessen the perception of the impact of health warnings on packages. Cathaoirleach, the Irish Cancer Society and the Irish Heart Foundation recently commissioned a quantitative study with 15 and 16-year-olds. The study found that A, cigarette packaging is viewed as appealing. It has power, generates a buzz, motivates purchase, whereas packaging is seen as the traditional stuff it's unattractive, it's old-fashioned, and it's rejected. Teens felt that positive brand attributes of appealing packs such as fun, glamour, masculinity, femininity can transfer to those who engage in the smoking. For teens, packaging is not just about the look and feel of the pack, it's about how the smoker looks. They feel better with the pack and with the brand. Plain packaging was immediately rejected by the teens, who expressed concerns about the look, the feel, the packaging, and how they were perceived by their peers, both of which were completely at odds with the image that the teens who would like to, in the first instance, pick up a cigarette and portray themselves as something else. The research overall established that teen smokers claimed that they would quit when plain packs were introduced, and non-light smokers said that they would most likely never continue smoking again. However, the measures will also have positive benefits for those already addicted to tobacco. Minister, we know in Australia, where they formally introduced plain brown packaging accompanied by graphic health warnings taking up 3/4 of the front of the pack for all tobacco products, effective from December 2012. So far, it's the only country in the world to have taken this step. Early findings from a study in Australia suggest that plain packaging seems to make tobacco less appealing and increase the urgency to quit smoking. Smokers were asked whether they were satisfied with their cigarettes as they were before the plain packaging was introduced and whether they felt that the quality was the same. They were also asked how often they thought about the harms of smoking, about quitting smoking, and if they approved of the plain packaging policy. And they were asked if they thought of the harm of smoking had been exaggerated. Minister, we both know that the results indicated that the perception of exaggerated tobacco harm from the tobacco industry, or the frequency in which smokers thought about damage from cigarettes might do, clearly the evidence from Australia. We know that plain package smokers were 51% more likely to look at immediately addressing their smoking addiction as a consequence of the initiative. And compared with smokers still using brown packs, the plain pack smokers were 66% more likely to think that their cigarettes were poorer quality than they were the previous year. And they were 70% more likely to say that they found it completely less satisfying. There was also 81% more likely to have thought about quitting at least once a day during the previous weeks, and to a rate of quitting that was a higher priority in their lives than they were when they were smoking brand pack cigarettes. The author of the study concluded, and I quote, that findings that smokers smoking from plain package evidence more frequent thought about and a priority for quitting than branded pack smokers is important, since frequency of thought about quitting has strong predictive validity in perspective for studies for actually making and supporting the attempt to quit. And they said, overall, the introductory effect we observed are consistent with broad objectives of plain packaging legislation. Minister, I'm sure you will agree that Fianna Fáil has a proud track record on combating harm done by tobacco products and in facing down the powerful lobbies acting on behalf of the tobacco industry. March 29th this year marked the 10th anniversary of the smoking ban in the workplace. It was in January 2003, as Minister for Health and Children, Micheál Martin, launched a report on the health effects of the environmental tobacco smoke in the workplace, and he gave notice of his intention to bring forward a ban. The advice contained in the report in relation to the dangers of passive smoking was unambiguous. Ventilation technologies were insufficient to give workers full protection from the hazards of tobacco smoke, and the exposures being best minimised by a full ban. The World Health Organization, International Agency for Research in Cancer, had also declared that environmental tobacco smoke included more than 50 known carcinogens. The bottom line, you didn't know, or you didn't have to be a full-on smoker to get cancer from smoking passively. You could get it from the smoker beside you. Another priority was for the well-being of children. As they grow, the exposure to environmental tobacco smoke reduces lung capacity and exercise tolerance. It lowers birth weight, and it has been identified as a significant contributor to asthma. The ban was supported by all political parties, was brought forward as a positive, progressive health and safety measure that would bestow positive benefits to workers and the general public. So has the smoking ban saved lives and improved health? Well, last year a new study showed that more than 3,700 deaths had been prevented in Ireland because people were less exposed to second-hand smoke. The study showed that mortality decreases were primarily due to the reductions in passive smoking, rather than a reductive approach in active smoking. The findings in the scientific paper were published in a medical journal, PLOS 1, and follow research by Brunel University in London, the Environmental Health Science Research Unit, and the Dublin Institute of Technology, the Tobacco Free Research Unit. The study showed the 26% reduction in heart disease, 32% fall in strokes, 38% drop in chronic obstructive pulmonary disease and mortality. This was the first study to demonstrate that a reduction in stroke and respiratory causes was as a direct result to that initiative. Earlier this year, the British medical publication The Lancet published a review on 11 international studies which show that smoking bans, including our own, have resulted in sharp falls in the number of children being admitted to hospitals with asthma, and that the number of babies being born before full term. The number of children born before full term who are smaller than they should have been, given the stage that they were born, has now declined by 5%. Other research in 2012 shows a significant 12% reduction in hospital admission for acute coronary syndrome just 1 year following the introduction of our smoking ban, and again 2 years later a further 13% drop in acute coronary syndrome admission was recorded. In Ireland, the percentage of smokers who banned smoking in the home rose considerably, 25%, compared to 17% in France and 38% in Germany and 28% in the Netherlands. So, Minister, there are significant achievements, and we look forward to playing our part in assisting with the enactment of this legislation. However, the smoking ban was not only a measure we put in place to combat tobacco addiction. We were the first country in the EU to eliminate all tobacco advertising from retail outlets. All tobacco products in shops are now stored out of sight. We banned self-service vending machines, exempt in licensed premises and registered clubs. Research has found that these measures resulted in massive falls in young people's awareness, accessibility to the drug cigarette. Plain packaging is the next logical step in progressively combating tobacco addiction. However, despite the progressive approach of all parties in this House, we can't become complacent. The fact that smoking remains the largest cause of preventable disease in this country. It kills half of all lifetime users. 5,200 people, which has been acknowledged in this House tonight, die from smoking-related illness every year. That means today 14 people have died or will die from cigarettes. We have to do more about this, and while we do not question the Minister's sincerity in this respect, we are not persuaded that the government as a whole are really committed to this fight. Consider last October's budget, which announced a €666 million cut for our health services, imposed a derisory increase of 10 cents on a package of 20 cigarettes. On top of this, last year the Taoiseach, Minister Noonan, then Minister Shatter, hosted a meeting of the Irish Tobacco Manufacturers Advisory Committee. Remember, this is an industry that has cost this country €1 billion in healthcare costs to the Exchequer. To hold such a meeting, essentially endorsing big tobacco and all of the damage that it does to the young people of this country, is reckless. Obviously, companies were ecstatic about their meeting because the Irish Tobacco Manufacturers Advisory Committee described it as very positive meeting with the Taoiseach, Minister Noonan and Minister Shatter. Minister, it is our view that tobacco is not a normal industry and cannot be allowed a seat up at the ministerial corridor. I suggest that Minister Howland should consider broadening the scope of the registration of the lobbying bill in 2014 to include the provision of banning all lobbying or any lobbying by the tobacco industry in this country of any public representative or any public official. And prior to that, government ministers should lead by example, refuse to meet any representative of the tobacco industry, an industry that is destructive to our society, to our public services, and to the delivery of our health service. If asked why we're supporting this legislation, I would respond that in Ireland, children start smoking at a younger age than in any other European Union country, approximately 16 years old. 78% of smokers started to smoke at the age of 18. 5,200 people die from smoking every year in Ireland. It's the size of Toontown being wiped out annually. In order to maintain current smoking levels, the tobacco industry has now to attract 50 new smokers a day to replace those who have died. And given the most that we have had with respect to smoking and those who have started before they're the age of 18, they really need to start recruiting children. So this is a critically important initiative. Our only concern about this bill, Minister, is that it hasn't secured EU approval for all its contents, and it's open to challenge by the courts, and that could result in this state being liable for damages. We hope that the bill is not being rushed purely for personal reasons as part of the Minister's enthusiasm to tackle this crisis. Minister, it's essential that this legislation has to be watertight, and any effort by the Minister to make it and to ensure that that will be achieved will be fully supported from this side of the House.